Hello everyone. In today's class I am going to discuss about the manual removal of placenta. So before starting that, I want to tell you that what is the meaning of retained placenta. When you have to remove the placenta manually, normally after the delivery within 15 minutes of time the placenta will deliver automatically, but in some cases it will retain inside the uterus. We have to remove it manually. So failure of placental delivery within 30 minutes after delivery of the fetus is called as retained placenta. In that time only you should go for manual removal of placenta. So now I'll discuss about the manual removal of the placenta. So manual removal placenta is a procedure to remove a retained placenta from the uterus after the childbirth. Retain means when, even though after the 30 minutes of delivery, placenta is not delivering spontaneously. So in that case, we have to remove it manually, means through hand. So procedure in that first step. Okay. So manual removal of placenta is done under general anesthesia. If not available, under deep sedation. Patient placed in a lithotomy position and bladder is catheterized. So this is the preliminary steps for the procedure, or you can say first steps. It means we are preparing the patient for the manual removal of the placenta. Second step is use antiseptic hand rub or wash hand and forearms. So you have to follow the aseptic techniques. Put high level disinfected or sterile surgical gloves on both hands. Okay. It's note, elbow length gloves should be used if available, and hold the umbilical cord with a clamp. Place the finger of the one hand into the vagina in the shape of cone by drawing the finger and the thumb together and into the uterine cavity, following the direction of the cord until the placenta is located. Next, third step is, when the placenta has been located, let go on the cord and move that hand onto the abdomen to support the fundus abdominally and to provide the contraction to prevent the uterine inversion. So move the finger of the hand in the uterus laterally until the edge of the placenta is located and supporting the fundus while detaching the placenta. So this is the third steps. You have to use both the hands. One hand you have to keep inside the uterus and one hand above the abdomen you have to put a massaging. Okay, it will be help for the removal of the placenta. Next, keeping the finger tightly together, ease the edge of the hand gently between the placenta and the uterine wall with the palm facing the placenta. So gradually move the hand back and forth in a smooth lateral motion until the whole placenta is separated from the uterine wall, withdrawing the hand from the uterus. Steps 4. When the placenta is completely separated. Now placenta you have separated with the help of your hand. That's why it is called as manual. Palpate the inside of the uterus cavity to ensure that all the placental tissue has been removed. Even though after removal also you have to check is there any contents remain or any bits remain in the uterus or not. Okay. Slowly withdraw the hand from the uterus, bringing the placenta with it, and continue to provide the counter retraction to the fundus by the pushing it in the opposite direction of the hand that is being withdrawn. Next, give oxytocin 20 units in 1 liter of IV fluid. Okay, and it should be 60 drops per minute. Massage for the fundus to encourage the atonic uterine contraction if there is a continued heavy bleeding. Give ergometrin 0.2 mg IM or give prostaglandin, and examine the uterine surface of the placenta to ensure that it is complete. Examine the woman carefully and repair any tears of the cervix or vagina or repair episiotomy. So this is after removal of the placenta. Once placenta is removed, it came outside, then you have to follow. These are the steps. Next step is examine the placenta for completeness. In the placenta we have 20 cotyledons, okay, 20 bits. So once it is delivered, we have to count that everything is present or not, any bit is still inside or not, okay, and check for the contracted uterus. And you have to check, make sure that uterus started to contract. Next is complication of manual removal of placenta. First, there is a chance of shock, postpartum hemorrhage, prepural sepsis, subinvolution, then inversion, hysterectomy, embolism, thrombophlebitis. So these are the complications that may occur if you go for manual removal of placenta. Thank you everyone. So here today we have discussed about the manual removal of the placenta, and I have sent you the link for the demonstration also how it is done in the help of dummy. Okay, so just go through it, and if you have any doubt you can ask. Thank you.